This presentation will teach you some basic information about IBS, or irritable bowel syndrome. We think this is important because very frequently people with chronic health problems suffer because they don't have enough information. Hopefully you'll find this useful. IBS is common. In fact, it's the most common functional GI problem in the United States. Direct and indirect costs, which includes missed work and such, are estimated to be $21 billion per year in this country. It's estimated between 10% and 15% of Americans suffer with IBS. And not everyone with IBS seeks the help of a physician because for some of them it's mild, it's just irritating. But it is responsible for between 2.5 and 3.5 million physician visits per year. Now, our purpose in giving you this information is not to get you to self-treat. It's just to give you ideas to discuss with your doctor. It's always a bad idea to treat yourself. But you might find that certain lifestyle changes can improve your symptoms. Also, you can go to wholehealthweb.com and read some of the research or link to a practitioner that can help you. First and foremost, are you sure it's IBS? You don't want to self-diagnose. IBS is a common benign condition of the colon appearing in two types. Okay, one with abdominal pain, constipation, diarrhea, or one alternating with the other. And then there's another type that's characterized by painless, intermittent, or continuous diarrhea. Patients often have heartburn, gas, anorexia, nausea, bloating after meals, vomiting. Sometimes they have a sense that they have to go to the bathroom, or that they didn't fully evacuate their bowels. This definition is from Taber's. One of the first things to consider is food sensitivity. Finding and addressing food sensitivities will help some patients, but not all of them. Food sensitivity is a little different from food allergy. You think of a food allergy as I ate strawberries, I broke out into a rash. People are sensitive to food. Sometimes they eat the food day in and day out, and they don't associate the food with a chronic symptom. And some docs think that as many as 33% of all chronic health problems are related to some kind of food sensitivity. This includes things like PMS and migraines, skin problems, and such. There are IBS diets. These are, usually avoiding certain classes of foods, but if there's a specific food that you're sensitive to and is not listed in the diet may not work for you. The other thing about IBS diets that you should pay attention to is, you want to avoid obvious junk. You don't want to eat greasy, fast food, sugar, and things like that as well. I mean, that goes beyond the food sensitivity issue. A very specific type of food sensitivity is celiac disease, which is a sensitivity to gluten, which is a protein that's found in wheat. It's found in other grains like barley and oats, and it's not in rice or quinoa or some of the other grains. But a very large percentage of the people with IBS symptoms actually have celiac disease. So finding and eliminating food sensitivities is frequently a good idea. It will fix some cases of IBS, but not all of them. There are lab tests for food sensitivities, and there's also elimination diets where you only eat one or two foods, see if your symptoms go away, and then gradually add foods. Some of the research was run this way. You can see that on Whole Health Web. Another issue that's been researched is bacterial overgrowth, specifically in the small intestine. A large number of irritable bowel syndrome sufferers actually have bacteria in the small intestine. Bacteria belongs in the large intestine, but not in the small intestine. And in these research studies, they found that when they find the bacterial overgrowth and they kill the bacteria, that the symptoms go away. Once again, like with the allergies, for some of the patients, not for all of them, because if that's not the mechanism that's causing the problem, the patient won't respond to it. Now, if we think of this digestion issue, a very wise man named Harry Eidner says that we should fix the digestive system from the north-south. And what that means is if you have a problem down in the lower intestine, large intestine, or even the small intestine, sometimes the problem might have started higher up the tube, like the mouth or the stomach. If you think about the digestive system, it's a tube that goes from your mouth to your anus. Everything in the digestive tract is literally outside of the body. The cells lining the digestive tract decide what goes in and what is not allowed into the body. So very frequently, if you're not digesting toward the top, and in other words, the stomach, something as simple as chewing. If you don't chew properly, you don't break down the food properly, it gives the bacteria an opportunity to grow, like if you think back to our small intestine overgrowth thing. Complex carbohydrates are frequently an issue. There's a woman named Elaine Gottschall that wrote a diet called the Specific Carbohydrate Diet. It was in a book called Food and the Gut Reaction. And she believed that we were not designed to eat as many complex carbohydrates as we do eat. Now, her diet is not a low carbohydrate diet like Atkins, because fruit has carbohydrate and it's permitted because there's simple sugars in fruit. What she's arguing against is the amount of complex carbohydrates or starches, things like potatoes and rice and bread and beans and things like that. And she says we eat these things and they overwhelm our digestive system, and they literally go into the lower part of the intestine and rot, and you get this bacterial overgrowth, and that'll cause not only IBS but things like Crohn's disease, ulcerative colitis, and so on. Now, natural healthcare practitioners will address this issue with things like hydrochloric acid as a supplement. In other words, I believe some people don't make enough hydrochloric acid, and we'll do that. This is something medicine doesn't recognize at all, but in natural healthcare we see this. Or pancreatic enzymes. In other words, they're going to help digest toward the upper part of the digestive tract and then solve the problem at the lower part of the digestive tract. And many times this works, but this is something you want to discuss with a health professional. And the fourth consideration you want to look into is probiotics. Probiotics are bacteria that actually belong in your intestine. There are a number of studies that show that supplementing people with IBS with probiotics does help them. Bacteria belong in your large intestine. They help produce vitamins. They help heal the lining of the GI tract, and they belong there. And there's more bacterial cells in your colon than there are in your entire body. The reason for that is that there's so many is they're smaller cells. That's why they can fit there. Some natural healthcare practitioners will treat a thing called dysbiosis, which is basically an overgrowth of the wrong kind of bacteria, yeast, or parasites, and they'll put a combination treatment together that'll include diet, maybe some kind of herbs or things to kill the wrong kinds of bugs that are living there, and then try to balance the colon again. And once again, this fixes many digestive problems, and it's something that's not generally recognized in medicine, but something that seems to be valid. And the last thing you want to consider with IBS is stress. Stress reduction works for a number of these patients. Now, that might not be the only issue, but it can help get symptoms under control. Sometimes a person who responds to stress reduction may actually have other digestive issues that probably should be addressed. If you go to wholehealthweb.com, we have a very good stress reduction exercise for you. It's free. And stress reduction is useful. And we hope you found this useful. We created Whole Health Web as a way for you to get health information. We found I'm Dr. Paul Varnes, and after 25 years of practice, I found that a lot of people are suffering unnecessarily, mainly because they don't have enough information. And we put a lot of this information, a lot of the research, things for you to look up about your health. A lot of the research articles that we mentioned in this short film can be found on Whole Health Web, including and also different various dietary changes that you can make, things about nutrition. We have information about herbs. We have recordings that will help you with habit control, stress reduction, and so on. So take a look at us if you thought this was worthwhile. wholehealthweb.com.